Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ovarian disease symptoms or signs are seen are amenorrhea, alopecia, theca cell hyperplasia, hyperandrogenism, and anovulation are seen in this patient. A 28-year-old lady Rani suspected to have polycystic ovarian disease. The sample for testing LH and FSH was best taken on the following day of menstruation. The sample for testing LH and FSH is taken from 1 to 4 days after menstrual cycle. Then Steen-Leventhal syndrome, true is. In Steen-Leventhal syndrome or polycystic ovarian disease, oligomenorrhea and amenorrhea are seen. It will enumerate cysts in the ovary, and it also causes theca cell hypertrophy is seen. PCOD, which of the following is seen? In PCOD, you will see hirsutism, secondary amenorrhea, and
thank you and thank you for watching.